I'm Kieran McCartan. I'm a professor in criminology at the University of the West of England in Bristol. And my research focuses on preventing and responding to sexual abuse. And over the years, I've done a lot of work that's looked at the role of probation in doing this, the role of community integration, and the role of risk management. And recently, I have started doing work in the field of trauma-informed practice and how this links to the way that we think about people who have committed offences in general and people who have committed sexual abuse specifically. Now, trauma-informed practice is something that we're talking a lot about at the minute, both in the prison service and in the probation service. But it's really important to understand what trauma is. So trauma is understanding what has happened to someone in their past. And a traumatic past can be a single event or a series of events. And trauma affects everyone differently. So there's not one clear cut understanding or definition of that for the individual. So it's about thinking about the individual, thinking about what happened to them, and also thinking about how you can respond to that trauma in a way that helps them stop and change their offending or delinquent behavior, and how that'll help them heal, rehabilitate, and integrate back into society again. Being trauma informed isn't just about working with people with convictions, it's also about supporting staff. Staff in probation and youth services have a very traumatizing job, and it is important to recognize that in the way that we support staff, in the way that we train staff, and the way in which we allow staff to heal from their working practices. So being trauma informed means that you work proactively and in a person-centered approach and a strengths-based approach with the individual who is on your caseload, but at the same time, your organization supports you in doing that in a way that encourages you to reflect upon the challenges that you face and to develop good, effective working practices so that you don't become traumatized in your day-to-day work. Recovery capital speaks to the skills and resources that individuals need to rehabilitate and reintegrate. And initially, it came from the drugs field. So it talked about social capital, physical capital, human capital, and cultural capital. But recently, there has been a fifth form of capital added to it, which is justice capital. And justice capital is the skills and resources within the system that enable colleagues and professionals to work effectively with people in their care. Now, this matters because we know that good engagement from probation staff and people working with young people within the system matters. The the better and more effective and more engaged professionals are in their working, and the better and more effective and more engaged they are in understanding the people that they're working with, the better advice and guidance and support that they can give. The work that is done by professionals is essential, it's important, and it means that in thinking about trauma-informed practice, as we mentioned earlier, we have to think about how we support staff, how we train staff, and how staff are able to engage in an effective way moving forward. So when we think about how people recover and reintegrate back into society post-conviction, we have to think about them as a whole person. We have to think about them as a member of society, but we also have to think about them as a service user and how can we provide the best and most effective service for them to engage with.